All right, take it away.
All right. Well, you guys, did you want to say something, Beth, or should I just get talking?
Well, I'm just so excited you're here. Really, really. And that is one of the benefits of Zoom and this pandemic is being able to do something like this. So, we've had Dr. Claudia speak many, many times and she's extremely knowledgeable, brilliant,
Mm.
kind, and funny. And I really think you're going to get a lot out of it.
Oh, it's so nice to be here. And what I would say is that I'm not shy about saying three magic words, which are I don't know. So my goal is to talk for maybe 25 to 30 minutes and then have plenty of time for you to ask questions. So this catchy title that we came up with, Surviving and Thriving in the Pandemic Paradigm, is really all about what can we do, and I really focus on the word thriving because I think this has been a stressful couple of years for everybody. Um, I think the key things that I want to start with are just, if you'd go to the next slide, just kind of run through the basics of Zoom etiquette. I think a lot of people know that. What I don't know is how to share my slides. So, my Zoom etiquette is to learn more about that. But in general, stay muted for the most part. Use the chat button down at the bottom of your screen if you want to add a question. And then if you have any particular questions about a particular slide and want to go back to a certain slide, just say you were talking about XYZ, tell me about that. We're going to talk a little bit about the pandemic, but I'm not really going to talk that much about it. I just have a couple of slides saying where we are, where we've been. Then we're going to talk about the stress response that Hans Selye was the first to use that term, and then talk about how are we treating stress, how do we know what to do, and the research from Alia Crum about reframing stress. And then we're going to end with a little bit of the Yoga Sutras because what you probably read is that I'm in yoga teacher training and I am the oldest person in my class and the least flexible in my class, but I'm really getting a lot out of it, and it's been, I don't know, just awe-inspiring to be in the midst of learning about yoga. So we will definitely have time for questions. So the next slide is the disclaimers, and that's basically if you go to, yeah, that I don't really, nobody pays me. I don't have any connections to pharmaceutical or nutraceutical companies. If I say, hey, you should take a certain product, I'm not saying that because somebody's paying me. I'm not an influencer. And we also don't have a physician-client relationship based on our discussion here. Hopefully you have a practitioner that you can ask questions of. And if we instigate some questions, then that's a good thing. My next slide is my introductory slide, which have you ever done this? Have you ever taken pictures of various aspects of your life and then thrown them into a slide to try to explain where you've been and who you are? On the upper left is the picture of a mom and a baby, and I delivered babies for 15, well, if you count residency, around 18 to 20 years, and then got interested in acupuncture and started working at the Alliance for Integrative Medicine. That's down at the bottom there on the left. The Alliance for Integrative Medicine is in Cincinnati, and that's where I trained and went to med school. And the 2008 financial crisis caused us to move to Texas. And so the middle and the bottom is the Baylor University Medical Center. So while I was in Texas, I worked at the for the GYN oncologist there at the Salmons Cancer Center. And I set up the survivorship program for um, women with cancer and also did preventive care and also diagnostic care for people that didn't have a cancer diagnosis yet. In the midst of my acupuncture training, I did my integrative medicine fellowship. That picture with other people holding sticks is our graduation. Um, and then those are the two books that I'm involved with, that I wrote the Finding Grace and Balance in the Cycle of Life, and then chapters in the Get Well, Stay Well, which Steve and Sandy Moyles are just getting ready to re-edit and publish again. The very last little logo is where I am right now in North Carolina. And after my husband retired, he said, "Where do you want to be?" And I said, "I want to be closer to my mom." And so we moved to be within reach of mom in the last couple of years of her life, and have no regrets whatsoever. And then when she died, it was like, well, I think I kind of want to do more. So I actually got some friends that work at this yoga studio that own it, and I said I'd love to do acupuncture again, and that's what I'm doing. So 3 days a week I'm doing that. So let's talk a little bit about the pandemic. I like to just specify this. I think most people know this, but it gets confusing sometimes. COVID-19 is the name of the infection, and SARS-CoV-2 is actually the name of the virus. It's the same thing as HIV and AIDS. You know, HIV is the name of the disease, is the name of the virus, and AIDS is the name of the disease. So you can see down at the bottom there that January of 2020 is when the first case came out. This slide is just looking at the number of cases, and those little lines are 200,000, 400,000, 600,000, the number of cases, and that's trending in a 7-day period. So I got this off the CDC website. If you want to really get into the data for your little zip code, it's very easy to do. You just go and look up whatever you want. But I decided to just look at the number of cases. And so you can see that this is through February 13th, 2022, and the caseload actually is coming down, but it's still in the 200,000 range in the United States. It did peak up around 800,000 to 1 million cases a day at this Omicron variant. You can see the other little hump just before that. That was the Delta variant. You can see the initial hump was the Alpha and Beta variant. So, you know, we're going through the Greek alphabet here, and I don't think anybody really knows how many letters we're going to go through, but it's likely to be several. And then the next slide is looking at the death rate, and unfortunately we're getting up around 1 million deaths. The death rate is coming back down again, but we're still, you can see the lines this time is 2,000 is where we are, above like 2,400 a day. And you know, you can see that the Omicron variant is not quite as deadly as the previous ones, but even when the case rates were not that high, we still had significant death rates even at the beginning of the pandemic. And it does seem to be hitting people at the beginning of the pandemic that were older or had other morbidities. They were immune suppressed, or they were had lung disease, or they had diabetes, overweight. These were all things that were contributing factors. Now these last couple of peaks are people that aren't vaccinated. So we're seeing the death rate has gone down in the vaccinated, but we're still seeing that as an issue in the vaccinated clients. And that's about all I'm going to say about numbers. But now I want to talk about, well, what is all this doing to us? And it's pretty stressful. I think just in general, people are more stressed. I see that around me. I see it in grocery stores. We have kind of like the blinders on our face. We're just getting what we need. We're not really making eye contact. You know, we're kind of staying 6 feet away as everybody recommends. So it's a very different time frame. I don't know about you, but we went to a Super Bowl party. You know, we used to live in Cincinnati, so, you know, we had to kind of cheer on the team. Unfortunately, they didn't win, but I think the thought went through our minds, like we had masks in our pockets. Should we have masks on? Should we not? We ended up not, but we were looking at each other today saying, well, I guess we didn't get anything because we're not sick now. You know, we're figuring, you know, how long do you have to wait for it to show up? So I think it's a mindset that we have right now. But definitely this is a stressful time. The American Psychological Association say 2/3 of people in the United States are feeling increased stress. I don't know how they can say that. I think everybody is feeling increased stress. They predict a mental health crisis, and the World Health Organization says stress is the epidemic of the 21st century. So we're using this word stress a lot, and we didn't really use it in a medical construct until this guy Hans Selye came along, and that's the next slide. He was an endocrinologist from Hungary. Flip the slide for me, would you? Thanks. He was a Hungarian endocrinologist, actually moved to the United States, did a lot of his animal research in the Midwest, you can kind of see he was mostly of his research was in the 50s and 60s. And he said basically, you know, there's some kind of non-specific response of the body. And he put it into this kind of construct that there was initially an alarm phase, then a resistance phase, and then an exhaustion phase. And to make it a little more accessible, the next slide kind of puts it, the stress response from Hans Selye with cats. So we have the alarm phase where, you know, the cat is initially, you know, at peace, but then resistance phase where it's like, blah, and then the exhaustion phase. So I'm just trying to make the point because, you know, cats. The next slide is the slide that we used at the Alliance, and it goes in a little bit more detail. And what I want to kind of make the point is that that initial response to stress is a focusing. It's like it says exhilarated. Well, that's really the, oh my gosh, I've got to get ready for a talk, or I've got to study for an exam, or I've got, you know, something coming down the pike. And so stress in and of itself isn't bad, but by being somewhat aroused, we are having a little more focus. We're more able to look, like somebody stops suddenly on the highway in front of us, we can go and hit the brake. So, you know, that having that ability to focus is a good thing. However, as you go along the right-hand side, the stress continues and persists, and we have more of a response that is less focused and more tired. And so the initial response is the adrenaline, epinephrine, norepinephrine. The subsequent ones are cortisol. And so cortisol is the one that's saying, hey, we need more glucose. We've got to like get these muscles to run so we can run away from the saber-toothed tiger or something like that. And when we have that constant cortisol, if we're not able to go back to the left-hand side of the curve, we're going to have more issues with sleeping, and we'll be like that guy in the middle there, just getting by. We'll have more aches and pains. We'll have a little bit more of a curve to our spine. We'll have fatigue, irritability, things like that. It's the very last part of the stress curve where we're irritable and we start having more and more stress, where we actually start to have things like exhaustion and weight gain or weight loss, insomnia. And then something happens, whether it's chemotherapy or a car accident or some kind of emotional trauma, and we fall off the stress curve. These would be my clients with bad multiple chemical sensitivities, you know, anything that you can think of where people are, you know, just really severely affected. And our whole focus is how can we support them to get them back over to the other side of the stress curve. The next slide. Well, could we measure stress? This is one example of how we can. This is salivary cortisol, where you're actually drooling. You're not spitting as much as you're drooling into a tube, and you collect the cortisol throughout the day. You can see on the top curve, that's a normal stress curve where the cortisol is high in the morning and then goes down as the day goes by. The bottom curve is somewhat flattened, and so if you can take away the idea that a steeper slope is normal and a flatter slope is not normal, then the next slide will give you an example of you know, you can measure it and does it matter? Yes, it does. These are breast cancer survivors, and what you can see is that the steeper slope actually has a longer breast cancer survival by about 10 years compared to the flat slope. Now recognize that if you're having a lot of stress, so much so that your cortisol is flattened, what that tells you is that that is chronic, debilitating stress. And so often when we're working with people to help them with stress management, we're trying to figure out what can we do to, you know, kind of unspool that stress, the things that are on their shoulders. So the next slide, in addition to cancer survivorship, immune response. So we know, for instance, that flu shots, that if you meditate before you get a flu shot, you're going to have a better response than if you just go in off the street. So if you do some kind of stress management, some kind of focused HeartMath, we're going to talk about later, has been shown to have a higher response to vaccinations. Behavioral issues in kids the same way. And then other things that can be affected by stress are things like, oh, thanks, allergies and heart disease. I have a copy of my slides. I can always look at them too. Thank you, Jamie. So definitely that we know, and I didn't go through all of the data. I didn't show you every paper that's out there, but please believe me when I tell you that stress can affect us in lots of different ways. And then the next slide, one of the ways that we're treating the stress is we recognize what's called the relaxation response. And it's really just a way of getting you to offset those physiologic effects caused by stress. So mind-body, go on next slide, the different kinds of mind-body medicine efficacy has been studied. And there's now data, this was a summary slide showing that treating coronary artery disease, if we use mind-body medicine, it makes a difference. Treating headaches, insomnia, incontinence, you can see all those things. And then the next slide, the same thing. There's this was a meta-analysis. 116 different studies used mind-body therapies in cancer patients, and they showed benefits in areas of anxiety, depression, mood, nausea. So at the Cancer Center in Dallas, what we found was that people came for acupuncture, but they also definitely wanted to learn relaxation breathing. There were a lot of things we were doing that were not just doing acupuncture. There was an art therapy there at Baylor. There's music therapy in the pre-op holding area. There was a guy who had a little portable piano that started playing music, which was just a lovely thing to listen to when you're getting ready for surgery. It's like, yeah, lovely. Next, how do you decide what mind-body therapy do you do? Because we're going to talk about a couple of them, but this was a nice way of looking at it, and then the next slide kind of highlights how to look at it. So if you go on to the next slide, thanks. So I turned it green and red just so that you'd really get my point. If we look at safety and efficacy, it's a no-brainer that if a process is both safe and efficacious, that's what we ought to do. Certainly monitor it, but that's definitely the way to go. And examples of this would be acupuncture, breath work, HeartMath. All of those things are both safe and efficacious. If we're pretty sure it's safe, but we're not sure if it's effective, that would be the top left. And that's fine. You can just monitor and say, is that making enough of a difference or not? Obviously, if something is not safe and it's not effective, you would not want to be doing that. And I think the problem is that you're going to have to ask advice of your healthcare practitioner. Is this safe? Should I do this? And kind of go from there. If we think it's effective, but we're not sure if it's safe. An example would be somebody with osteoporosis. Would we want them to do neck adjustments with chiropractic? Maybe not. So, we just kind of judge, how do we decide what are the best treatments to do here? So the next slide, what are some of the techniques? And I think that you probably could come up with this. If I were in front of you in a room, we would be, instead of using PowerPoint, we'd probably be thinking of these and brainstorming them together. But meditation, I'm going to give you a little bit of data on meditation versus taking a vacation that was done at the Chopra Center, which I thought was interesting. Breath work. Now, one of the 8 limbs of yoga is pranayama, which is a type of breath work. Well, here it is, in mind-body techniques. 5,000 years later, we're talking about breath work in a Jewish Family Services talk. That's kind of cool. Types of biofeedback, including HeartMath. Muse, which is a monitor that goes on the head and is measuring your EEG wavelengths, and it's a way of teaching you how to get into meditation. Yoga, of course, we talked about that. Tai Chi, which is another type of movement with breath. Hypnosis, relaxation therapies, again, usually with a trained provider, somebody who's trained to do the technique. Music therapy, art therapy, mindfulness-based stress reduction. This is again a particular program where people learn techniques in relaxation, and then acupuncture. So all of those, next slide, work in the same way. We're basically working on changing from our sympathetic to our parasympathetic nervous system. Next slide. And we're getting the vagus nerve fired. It is not difficult to grasp when you recognize that what we're doing is we're trying to get that fight or flight adrenaline process to kind of calm down a little bit. So we look at, well, why are we having these responses? And it all comes down to that little amygdala at the base of the brain. And it's the little alarm bell, or the guy at the airport, up at traffic control, who's out looking out over the fields, looking for anything that's potentially dangerous. And if anything is perceived, then the message is sent to the hypothalamus that says, hey, I think this is dangerous, uh-oh. And then the response is made. Either we, say, yeah, look in the file system and say, yeah, that's somebody braking suddenly on the highway. You probably ought to stop. It happens quicker than that. But, so being able to respond to that danger is there, and very important. Epinephrine, norepinephrine, cortisol, glucose, all of those things, so we can respond. And originally it was probably saber-toothed tigers, but now it's, I'm in danger, I need to be saved. So that amygdala is really important, and it's instantaneous. The other side of the brain, the anterior cingulate gyrus, is at the front of the brain, more of the frontal cortex, and right behind it. And that's where our empathy, compassion, social awareness, intuition, more of a measured response. We don't necessarily have an instantaneous response from our anterior cingulate gyrus, but it's just as important. And understanding that we're always in balance there. Yeah, the next slide's fine. But there tends to be sort of a negativity bias, that, it was always, as opposed to getting a carrot versus avoiding sticks, from a survival technique, we really needed to avoid the sticks, the danger, more than we needed to have the positive reinforcement. So we really tend to over-focus on bad news and react to it, and sensitize the brain sometimes to the negative. And the next slide. So this is the Chopra study that I was mentioning. Kind of an interesting study. What they did is the Chopra Center had a meditation retreat, and what they did is they had people that were signed up just for the retreat, and then they recruited 60 more people, and they split them in two. 30 of them were just going to take a vacation at the Chopra Center, and the other 30 were going to take the meditation retreat. And so they were then going to measure different blood tests at a baseline, 1 month and 10 months later. Next slide. And that just kind of shows you what the different people were doing. So the right hand, the 30 were already enrolled in the retreat. They had a meditation teacher. They were doing sound meditation, body and breath awareness, self-reflection. The 60 that were recruited, I don't know why they didn't call me, because I would have gone to this retreat, and I don't care which group I would have been in, I would have done that. But anyway, 30 of them just took a vacation, the one on the left, and then the middle ones were actually joined the meditation retreat. So that they all had the same diet. There was typical exercise in the vacation people, and then they had daily classes on healthy living, whereas the other people were learning how to meditate. And then the next slide shows the results, and that they were measuring in particular some anti-aging, basically. They were looking both at the gene networks involved in stress response and inflammation, and then they saw that telomerase activity, which is the little when the cells divide, there's the telomere is the way that the cells divide, and as we get older, the telomeres get shorter. So they could measure that and say, we kind of get an idea of how fast we're aging. So they could see that the novice meditators had more beneficial changes and Alzheimer's related markers than just the people that went for a vacation. So the bottom line is meditation is better than just taking a vacation, if I haven't made that clear enough. So interesting study, and it's hard to figure that out. Now here's this mindfulness-based stress response study, and what this was basically checking the flu vaccine versus waitlist controls. And so they were doing mindfulness-based meditation, and they proved that the response to the flu vaccine was higher in the people that did the MBSR versus the people that were waitlisting for the program. And pretty remarkable. And I would say, maybe think about doing some kind of meditation before you do any kind of vaccination or really any kind of surgery or anything. And then the next one is on HeartMath. We're just going to do HeartMath just for a second. I'm not going to hook you up, but this is measuring your heart rate variability and then doing breath work as your heart rate's being measured. And if we can get your heart rate to vary with your breath, then we call that you are in coherence. That's that bottom squiggle line. And if you're not in coherence, that's the top very squiggly line. So we're just going to do HeartMath together. If you would, just put your feet flat on the floor. I'm going to have you put your hand right on your heart. And we're just going to breathe in and hold it and breathe out and hold it. And just breathe comfortably like that, if you would, for just a minute. This is called paced breathing, where you breathe and then pause and then breathe and then pause. The second part of it is, after the paced breathing, is you imagine that you're breathing in and out through your heart, that your heart is the focus of that breath. So it's coming in and out through your hand right over your heart. And then the third thing is you add a positive emotion or a positive memory. It could be a puppy licking your face. It could be the birth of a child. It could be a view from the top of Mount Everest. Choose whatever positive memory or focus you want. But you add that with the three things: the paced breathing, the heart focus, and the positive memory. Great. Now, I could hook you up to a monitor and prove that you got into coherence and tell you that by doing that regularly, maybe first thing in the morning or at night before you go to bed, that you will reduce your risks of panic disorder, HIV symptoms, ADHD, diabetes, menopausal hot flashes, fatigue, etc. So HeartMath, a very powerful tool. Definitely many people can train you in it, but heartmath.com, where they sell the little monitor things, and heartmath.org is where all the data is. And then the next one is yoga. Next slide. Interesting study on insomnia in postmenopausal women, often an issue. Things change in our sleep patterns as we get older, that different patterns of sleep change, and that in particular hot flashes are one of the things that can change our amount of time in REM sleep. And so that this is interesting study that showed that insomnia was improved. And then the next slide is the acupuncture data. I could have probably done the whole 30 minutes on acupuncture, but I just kind of slowed down to just one slide. That's remarkable restraint on my part, I think. But post-chemotherapy fatigue, very good data. Anxiety, depression, insomnia, I could probably list. And of course, pain. It's very good for pain, too. All right, the next, and then this is the point I was going to try to really make, which is very interesting data from a woman named Alia Crum. And that's her website there. Beth has a copy of these slides, which she'll send to you, sparktools.org/rethinkingstress. And what she realized, she did many, many studies, is that one of the best ways to deal with stress, not that any of the things I haven't been talking about are important, but is actually change the mindset, and that would change the response. And the example, um, I think for me, is the power of Zoom, or any other online connection that um, we've all felt somewhat isolated, but yet I don't know about you, but I've been doing some Zoom pretty regularly, one with a group of college buddies once a week that's been, really fulfilling and fun. And then every 2 weeks I meet with a group of people that I went on a meditation retreat with. And that's when we take turns leading a meditation. So, it's been very powerful, and I'm sure there's other examples. I've probably done more learning on Zoom than I have my whole life. I'm sure the rest of you are the same way. Um, and you figure out what works and what doesn't. What can I be doing during a Zoom talk that I can't normally do? But she makes the point that if we change our mindset, that we can actually change our response in 4 different ways. We focus on possible opportunities instead of unpleasant effects. So that's the example of Zoom. We connect to feelings of hope, connection of resilience, which is interesting because there's been a lot of data on why some people can respond to stress better than others, and it seems to be that they can get back to the other side of the stress curve faster. Do they metabolize their adrenaline faster? Is it genetic? Or is it just sociocultural? And then obviously motivator shifts the ability to focus and recognize the positives that stress gives us. Um, so interesting that data, I thought. And then the last slide is the 60-plus-year-old woman doing a revolved triangle pose for the first time. Thank you very much. And the I think the Yoga Sutra 1.2, the Yoga Chitta Vritti Nirodha, yoga is to still the patterning of the consciousness or the monkey mind. And this was, thousands of years ago that they came up with this idea that calming the monkey mind is a good thing. And so, and moving and learning to move our bodies as we breathe is a good thing. So I end there, and I'm happy to answer any questions that you have. So, and I think, why don't we go to people's faces, Jamie, instead? Although it is cute to see. Today I'll live in the moment, unless the moment's unpleasant, in which case I'll eat a cookie. But, but I think that, getting to be able to see people's faces would be lovely.